Hepatitis B surface antibodies, anti-HBs, a key factor in immunity. Hepatitis B is a major global health problem that affects millions of people. Among the various tools used to diagnose and monitor the disease, hepatitis B surface antibodies, anti-HBs, are one of the most important markers. Understanding the role of anti-HBs helps healthcare professionals assess immunity, distinguish previous infections, and evaluate the effectiveness of vaccines. This antibody plays a key role in the body's immune response to hepatitis B, whether through natural infection or vaccination. When the body encounters the hepatitis B virus, HBV, it responds by mounting an immune defense. This involves a complex series of reactions designed to neutralize the virus and protect the body from potential liver damage. One of the key players in this defense mechanism is anti-HBs, an antibody that responds to the presence of HBV surface antigens. These antigens coat the outer surface of the virus and trigger the immune system to produce antibodies that can bind to and neutralize them. The presence of these antibodies in the blood indicates that the body has been exposed to the virus and is actively working to fight it off. The presence of anti-HBs in the blood is an important indicator of immunity. There are two main situations in which these antibodies are detected: natural infection or vaccination. For people who have been exposed to the HBV virus through natural infection, the presence of anti-HBs antibodies is a sign of recovery and immunity. Once a person is infected, their immune system works to neutralize the virus by producing various antibodies. After the body has successfully cleared the infection, anti-HBs antibodies can persist in the blood for years, often for life, providing lasting immunity to future infections. Recovery from HBV typically involves the disappearance of the hepatitis B surface antigen, indicating active infection, followed by the appearance of anti-HBs antibodies. This shift indicates that the body has successfully fought the virus and is immune. For healthcare providers, this sign is critical to distinguishing between individuals who have recovered from the infection and those who are still at risk of spreading the virus. The most common way to develop immunity to HBV is through vaccination, especially in areas with comprehensive public health programs. The HBV vaccine is designed to stimulate the immune system to produce anti-HBs without exposing the individual to the virus itself. The vaccine contains synthetic hepatitis B surface antigen, which the immune system recognizes as a threat. In response, the body produces anti-HBs antibodies, just as it would during a natural infection. Detection of anti-HBs after vaccination confirms that the person has successfully developed immunity to hepatitis B. Vaccinated people typically show high levels of anti-HBs antibodies, which protect them from infection with the virus. For individuals who have developed immunity, either through natural infection or vaccination, the presence of anti-HBs ensures that the body is well equipped to handle future exposure to HBV. Upon re-exposure to the virus, the immune system can quickly produce additional antibodies to neutralize the virus before it has a chance to cause an infection. This rapid response is essential to preventing the virus from gaining a foothold in the body, thereby protecting individuals from the chronic liver disease that HBV can cause. In addition, anti-HBs does more than just neutralize the virus. These antibodies are also a key component of the body's memory immune response. When the immune system encounters HBV for the first time, it not only produces antibodies to fight the virus, but also forms memory cells that remember the virus. If the individual is exposed to the virus again in the future, these memory cells can quickly trigger the production of anti-HBs antibodies, providing rapid and effective protection. Antibody concentrations in the blood are measured in milli-international units per milliliter, and results are categorized based on the level of immunity they indicate. Positive, immune, greater than 10 milli-international units per milliliter. If the test shows an antibody level at or above 10 milli-international units per milliliter, it is considered a positive result, indicating immunity to HBV. Individuals with these levels are protected from future infections, whether immunity stems from vaccination or recovery from a past infection. In healthcare settings, this threshold is often referred to as the level of protection, meaning that the immune system is effectively preventing HBV from causing infection. Negative, non-immune, less than 10 milli-international units per milliliter. Levels below 10 milli-international units per milliliter are considered non-immune, meaning that the person either was not vaccinated, the vaccine did not produce an adequate immune response, or there was no past exposure to the virus. In this case, healthcare providers will often recommend a course of HBV vaccine or a booster shot to help the individual develop adequate immunity. Indeterminate, borderline. Sometimes, results may fall into the indeterminate range, especially if the level is slightly below or close to the 10 milli-international units per milliliter threshold. In these cases, a healthcare provider may recommend retesting or additional vaccinations to ensure protective immunity is achieved.